Many, if not most, hospitals across Colorado are hemorrhaging money.
The Colorado Hospital Association is sounding the alarm tonight, hoping to stop the bleeding here. Hospitals are getting hit from multiple angles right now. They saw a 60% increase in uncompensated care last year. They've lost $4 billion in Medicaid and Medicare reimbursements. Operating costs are also up 13%.
Earlier this month, Banner Health closed its emergency department in Loveland, and last week, Delta Health became the latest hospital to close its obstetrics unit. Your investigator Sean Boyd went to Delta over on the western slope for this story.
Well, Sean, rural hospitals here really have been struggling for years. It's just worse.
Right, and it has reached a tipping point. Delta Health is the second hospital in 5 months to close its obstetrics unit after Arkansas Valley. Half of rural Colorado is now a maternal care desert, and it could get worse.
Hi, how are you doing?
For 9 months, Erica Quain had planned to give birth at Stork's Landing, Delta Health's labor and delivery unit. But 2 weeks before baby number 2's due date, she learned the unit was closing.
How could they close? That's like closing the ER.
The next closest hospital is at least a half-hour away. Quain's first baby had a life-threatening complication that required quick thinking by the delivery team.
They saved his life, and I'm forever grateful to them for that. I need them to deliver this baby.
It's probably the toughest decision that I've ever had to make in my healthcare career.
Delta Health CEO John Coe says the hospital lost half its family practice obstetricians and couldn't attract new ones because it couldn't afford the latest robotic equipment used for gynecologic surgeries.
This is just the tip of the iceberg.
For the last 5 years, Coe says the hospital has been in the red by more than $1 million a year, and it's not alone. According to the Colorado Hospital Association, nearly 3/4 of hospitals in rural and urban Colorado have unsustainable operating margins. It blames state lawmakers in part, pointing to nearly 350 new state laws in 5 years that impact hospitals, including new reporting mandates on everything from charity care to complaint resolution, new patient notifications on everything from facility fees to provider qualifications, and new rules around everything from carbon emissions to staff name tags.
Those unfunded mandates just cripple a hospital because we have people chasing that, then you can't have staff doing exactly what it is that they should be doing, which is taking care of patients.
The legislature has also expanded Medicaid services and requires hospitals to screen uninsured patients for Medicaid eligibility, provide discounted care, and bill forgiveness after 3 years.
You take all of those and you add them all together, and hence the struggle.
It's not just the state. The Hospital Association says President Trump's Big Beautiful Bill Act will reduce funding for hospitals in Colorado by nearly $10.5 billion over the next 10 years and increase the number of uninsured patients due to new Medicaid eligibility rules. While the bill includes money to help rural hospitals, federal law limits the number of rural designations in geographical areas. And Delta is 1 mile too close to Montrose to qualify as rural, causing it to lose out on millions of dollars in grants and prescription drug discounts.
My hope is that everybody takes a breath and just lets healthcare be. Leave us be for like 2 to 3 years.
Perhaps nothing illustrates the financial challenges at Delta Health more than this trailer. The hospital is renting an industrial-size air conditioner for $17,000 a month because it can't afford the $500,000 to buy a new one. It hopes to save up the money by next spring. But the nurse call system is also on its last leg. That's $700,000.
I worry about the hospital every day.
State Representative Matt Soper has lived in Delta all his life and is on Delta Health's board of directors. He says saving the hospital is about saving lives.
When I walk through the grocery store and someone says, "Hey, Matt, thank you for the work you've done to keep Delta open." And I know in the back of my head, we're just barely hanging on. And it brings tears to my eyes. We will do whatever it takes to keep health care here, but it may not exist the way it does today.
That's what worries Erica Quain.
And after women move their OB care, they normally move their whole family's care.
I guess the message I would give to the community is we haven't and we won't ever give up. I lost my mom and dad early. You know, they died way too young. They didn't have the access to the care that they needed. And so I know how much it hurts to not have that. And that's really what keeps me going in healthcare.
Cohey hopes to eventually reopen the maternity ward after the hospital foundation raised $2 million for the robotic equipment used in the gynecologic surgeries. But he says much of the hospital's equipment is 20 years old and breaking down. While Delta approved a sales tax increase for the hospital, 75% of Delta Health's patients are on Medicaid or Medicare, which they lose money on. And Cohey says commercial carriers also shortchange rural hospitals. Good news is Erica Quain's doctor agreed to induce her a few days early, and she and baby Colton are doing great. I got a picture. That's great. That's good news.
One little kernel of good news.
I know.
And you listed a lot of problems state and federal lawmakers are causing. Are any of them doing anything to solve any of these problems?
Yeah, you know, I spoke with Congressman Jeff Hurd, who represents this district. He told me he's trying to help Delta get a critical access designation, which would increase Medicare reimbursement. He also plans to work on regulation to ensure that Delta can access some of the $50 billion for rural hospitals in the Big Beautiful Bill Act. At the state level, lawmakers passed and Governor Polis signed a bipartisan bill that provides $90 million over the next 5 years for rural providers. They also passed a bill pushed by the governor that requires a fiscal analysis of all health care legislation. Polis has said he will not sign any bills that raise health care costs. But you know, you heard John Cohey. We just need a break, you know, just stop the unfunded mandates for a few years. You know, they are just weighing us down. So I don't know. Delta is just one of the many hospitals in this state that are struggling right now. So it is just a scary time.
Really broad part of it, you know, broader even healthcare crisis, of course, on so many levels. Rural hospitals, boy, are they getting it.
All right, Sean, thank you for traveling out there to Delta for this. We appreciate it.